Hello, everyone. I'm here today with Dr. Charlene Dewey, Professor of Internal Medicine at Vanderbilt University, and importantly, Director of the Center for Professional Health and Chair of the Faculty Wellness Committee at Vanderbilt University. She has a brand new and very timely article in the Annals of Internal Medicine this week. In fact, it hit the press on the 20th, called Supporting Clinicians During the COVID-19 Pandemic. I can't think of a more timely topic for clinicians as leaders, but also as humans and individuals. My pleasure to introduce Dr. Charlene Dewey.
Thank you, John. How are you and how is everybody today? I hope you're practicing social distancing well and taking care of yourself.
We in fact, are meeting today virtually to practice that social distance, but alas, that's not one of the realities for our clinical colleagues who are at the very front lines of care each and every day. And in your article, you raised so many good points that are helpful. Let's talk first about how clinicians, physicians, as leaders, create a culture that really is as healthy as possible during a time that is inherently and extraordinarily stressful.
Well, first let's remember when we define culture, it's defined by the people that make up that culture. So yes, it's definitely leaders and what they do, but it's also the individuals and making sure that they're contributing to a good, healthy, well community. From the leadership perspective, certainly the more they role model and the more they send clear messages of support and understanding and realizing that we might not be able to solve the pandemic today, but we're all in this together as a message and an attitude toward everybody that's working together. I think that is one of the most important things that helps support a culture around supporting physicians, supporting nurses, and other employees at the health center that also is going to be impacted by this. So the more the leader takes the initiative to send out supportive emails, to send out updates on a consistent schedule so that providers and employees know exactly where to access that data, and to make sure that the leaders are also sending a message that is a positive message of hope, a message of we might not be able to fix this, but we can be in it together. We might have troubles with this, but here's what we're doing to address that. It's that balance between what the reality is and what we're dealing with the hope that we're all going to make it through at the same time. And I think that's a nice place for leaders to start.
Well, thanks so much. I think culture is so critically important, and that culture applies whether it's the large system, the facility, or frankly, the dynamics of a team taking care of patients on a particular unit of a hospital. But physicians, clinicians are people as well, and the stresses are extraordinary, particularly for breeds of individuals who tend to be control freaks. This is an environment where we're not in control. What are your thoughts on how clinicians can really provide themselves the personal care necessary to be as effective as individuals as well as clinicians?
So one of the first things is the physician has to kind of take time for themselves and make sure that they're maintaining their own basic necessities, eating well, sleeping well, getting breaks, understanding when they're stressed, realizing what those triggers are for them and how they manifest for themselves and the colleagues that they're working with. So those basic things of just taking care of yourself will put you in a better mind frame. When we're stressed and we're frustrated or we're at burnout, we're not going to think as clearly. We're not going to be able to react to the stresses as they come very easily. So it goes back to the basics that every individual has to take care of themselves and be that priority. The more they prioritize themselves and say, if I get this good rest today, then tomorrow when I get to work, I'm going to be my best self, and then in my best self, I can better care for my patients, I can better care for my family, I can better care for my team. That's the basic part, and that's where we want everybody to start. But there's also that part of managing some of the fears. And I'm imagining the ethical and the moral and the spiritual dilemmas that are starting to come up in people's minds. Like, if I take care of a COVID-19 patient, and I go home, do I accidentally, have one of my family members or my children getting sick from this? And so these dilemmas and these stresses have to be managed. And so having little groups or a partner or a team of people where you can talk about some of those fears and actually hear what other people are saying. One, because we just need to sometimes vent and get it out. We just need to have the thoughts and get it out of our minds. But then the other thing is that when people come together and we support each other, then we can also help manage what our expectations are and manage those fears that we might face. The reality is that any one of us that take care of any patients could at some time come in contact with a patient who has the novel coronavirus. That is a real fear, but at the same time, we have to manage that fear and keep it controlled. And that's why the personal protective equipment is so important. Physicians understand what does that mean to say we have personal protective equipment, from the goggles, the face mask, the gloves, the gowns, and making sure that when we're taking care of a patient, that we're doing the best we can to protect ourselves in that. That helps us reduce some of that fear. And then we manage it through the support and the relationships that we have with each other. Sometimes we have to laugh about it. Sometimes we might cry about it, but it's dealing with those emotions and that fear as part of our reality, but also knowing that we're doing the best we possibly can. Allowing yourself to be human, saying it's normal for anyone to feel like they might have some fear around this, but to also manage that fear with some positive thoughts, that I'm taking care of myself, I'm in my best health, I'm using my personal protective equipment, and then hopefully in the end we'll all be safer in that realm. But we have to control that mental part, and that might also drive up our anxieties as well as taking care of our physical needs of the sleep and the resting and the eating.
Well, these are great points. And you make the note that the masks, the gloves, the goggles, they're not just physical barriers, they're psychological protections as well. And creating an environment of psychological safety is important not only for the individual, but their team. You've also raised the point that it's not novel, although coronavirus is novel, that we as physicians and other clinicians take care of patients with infectious disease, tuberculosis, for example. And those practices also allow us to not carry those diseases home to family. Ultimately, that if we're not investing in ourselves, in our health, and frankly, even finding moments in a very, very busy, very extended day to stop and reframe, to appreciate, then we can't bring our best self and serve either patients or as leaders. You've been doing a great deal of work in this area. Where can one find additional resources on developing this type of leadership capability and psychological safety in terms of support for oneself and one's team?
Well, there's a couple of places. The American College of Physicians, one of the largest organizations for internal medicine physicians, has trained numerous wellness champions in each state of our country. And so they can certainly be examples and role models, and we'll have resources. The ACP webpage has a wellness resource for physicians. The AMA has a wellness resource page, and there are more of them out there. Some other great places that actually do a number of wellness activities well, including Vanderbilt, Stanford, Mayo Clinic, Southern Illinois University, where Dr. Hingle is, Minnesota, Henneman Health, where Dr. Linzer is, the colleagues that I wrote the article with. So there are other great academic health science centers that are also doing great things and have a variety of different activities. In one of our planning meetings just today for our own center, we're going to start probably posting some podcasts and having some discussion groups, hopefully as early as next week, so that physicians kind of have this place for the psychological safety where they can talk about things and then realize that they can get back to work quickly. Because what you raised is these short times when we sometimes have to take a little bit of a break. And that's what I actually recommend. It doesn't have to be a long or big or involved kind of program. Sometimes something as simple as 2 to 5 minutes of a downtime, of a prayer, a meditation, a mantra, a relaxation exercise, sharing with somebody else, laughing, joking with each other. It's little snippets of things that can help give us that renewed resilience and energy to kind of go back to work. So use some of the web pages for sure. They have tons of information that physicians can look at, and then hopefully we'll be starting some as well.
Well, you're terrific to join us today, and I want to put a plug in for my colleagues right here in HCA Healthcare, Dr. Frank Drummond and Amy Rushton, who also do podcasts on self-care, very complimentary to the comments that you offered, Dr. Dewey. Let me just close by thanking you so much for your work, your support. The reference is supporting clinicians during the COVID-19 pandemic, and it's in the March 20th Annals of Internal Medicine. Lastly, a sincere thanks to each and every clinician out there who's working not only to take care of patients who may be affected by COVID, but who really take care of patients, take care of communities each and every day. Don't forget, take care of yourselves. Thanks so much.